Welcome, welcome, welcome. This is the Second Opinion. We're a sports medicine podcast. I'm Dr. Dhokal.
I'm Dr. Glass.
Mr. Dustin Glass. Happy Monday to you, man.
Yeah, that's what I was just going to say. Happy Monday, man. The weekend flew by, it seemed like.
This last week did fly by. It was busy for me on my end. What about you?
Yeah, really busy. I worked all weekend. I got some Hyperbarics been going crazy, so we've been trying to get people in when we can, and I had a good weekend to be able to do that, so got a lot in, so it was good.
That's good, man. With the hyperbarics, are you getting more general population people coming in for different types of ailments, or is it more athlete related?
Yeah, right now, no, this is mostly general pop, a couple cancers, and then what else? Achilles, which was interesting because we were doing all that research on Achilles in our podcast, and then I had one come in a week ago. She just backed up on the curb. Dog got kind of caught up in her feet, and she stepped back and popped it. And she hadn't seen the ortho yet. It had been about a week. She came in. She was laying face down, and I did the squeeze test, and nothing. I looked at her husband, and he just put his head down. I'm like, "You saw that?" I said, "You know what that means?" He's all, "Yes."
Oh man, yeah, just like that, huh?
Yeah, so nothing, no response. The other one, pop. You know, is the squeeze test. The squeeze test, for everybody listening, you have the patient face down, bend their knee, and so we squeeze the calf. When we squeeze the calf, the Achilles and the calf activate to flex the foot, and if there is no response, there's a high probability that there is a tear or a break in the system. So now at that point, we send off to the ortho, get an MRI, or get the MRI and figure out, is it a vertical? Is it a horizontal? Is it just really swollen and, strained? There's other mechanisms that can cause the test to be a positive test, but the high probability that it's torn.
Yeah, most of the time, if that foot doesn't move when you do that squeeze test, I don't want to say 100% because there's always some outlier, which I wanted to talk to you about. But the two times I've come across it where it was significant, it was like right away, so
right.
You want to get the imaging done to confirm it, for peace of mind and to see the extent of the damage, of course. But that's one of those where you can tell right away.
Yeah, for sure. And I sent her off to one of my ortho friends from Colonel and Job, and that work with the teams and stuff. And she was kind of put off because he told her right off that she needed surgery without even an MRI. And I had to explain to her because she's like, I want a second opinion. I'm like, I said, well, he sent you out for an MRI. He's doing his due diligence, but I'm telling you, he's done this so many times. And like you just said, you don't want to say 100% because there's always the outliers, but he knows what it looks like. That's what he does for a living. So, he's not doing anything wrong by telling you right off the bat. Some patients are so jaded on orthos, they feel like, they're just cutters and all this. And it's like any profession, right? There's some out there that just do that, but most do not want to do that, just cut just to be cutting anymore. It's a different
honestly, look, I mean, everyone's, patient availability is reduced, so I'm sure they're plenty busy. I don't think any orthos need to stack any surgeries in excess just to do them, and I mean, I get the patient's perspective, right? It's a significant surgery, especially if you're not an athlete and that's never happened before. You're just holding out hope that there's a little bit of chance maybe you can rest it and rehab it. I had somebody last week come in who has to go under for a minor procedure. It's a 5-minute thing. And he's like, I don't want to go under. I don't like that. Like, I don't like it. He's had concussions like I've had. And he said, dude, do you know when you get knocked out and you're out and it's just lights out and it's like a light switch. It's on and it's off. And I said, I do know that. And he goes, that's how I feel like about when I go under. He's like, everything's happy. You're going to go through this procedure, sir. Everything's going to be normal. He's like, but what if it doesn't? That's the last thing I see. And I'm asleep and it's lights out. And now my whole family's mourning and I'm none the wiser. I'm out, And so that was a conversation he was having with me about just being apprehensive about it. And I looked up some stats on anesthesia and going under and tried to make him feel better. But if I'm being honest with you, bro, I don't like it,
Yeah, no, I hear you on that. Let's talk about that because with this case, she really doesn't want to have surgery, which I get, nobody does. And she's starting to feel better, and she has no pain, and she can walk now and do everything with no pain. And she's like, I think I can be fine. I'm like, okay. And I did the whole analogy about, what about, and it was funny. I'm like, okay, we're at the mall, and things go sideways, and you have to run out and jump over things. And she's all, well, I couldn't do that before. I'm like, okay, now you're just being difficult. I straight up told her, I said, okay, come on.
Right.
It was like the third thing she was resistant on and she was just trying to, and I'm like, listen, you're just being difficult. You get what I'm trying to say. You're not functional right now, right? And she's like, I know. I said, okay, I get that you don't want to have surgery. So in talking with her husband, when she was in the hyperbarics, he said the resistance is she had a family member or a friend pass away on the table from anesthesia. So she really doesn't want to do that. So, and it come to find out it was, and they determined it was because the patient was prone, okay, on her stomach, It was a back surgery. So there was a link to being prone and anesthesia. So in her head, she's like, I don't want to have this surgery because I have to be prone to have Achilles tendon. So she went on Google and found that it can be done supine.
Wow.
Okay. The Achilles tendon. And she said, now that I know that, I'm going to request that or ask them about it. I said, to be honest, I said, you can ask that, request that. I said, I think that's going to be a very hard find for a doctor that's going to be really wanting to do that. I said, can they? Yes. Google's going to tell you what you want to hear. And can you do that? Yes. Just like, but he's not going to, he prefer to have you prone because he can get to it. It's so much easier. So maybe a couple hours.
Carriage.
Like what's that? Yeah.
Are you going to be under the leg?
Yeah.
Like doing some...
Yes. So I said, maybe they can do it, but it's going to take maybe like whatever the amount of time, a 2-hour surgery. Now you might have a 4-hour surgery, and the doctor's not happy about it really. Do you want your doctor really not happy going into a surgery, right? Like, because he has to do more work, maybe use different tools, do a different bed. I said, can they do it? Yeah, probably they can, but is it the right thing? I can adjust you from the front, but is that the best way to adjust you?
Sure.
Like, I can move things. And then they're like, yeah, you're right. Like, so I said, just because they can, because once she saw that they could, that's all she wanted. And she's equating it as it's equal type surgery, right?
Yeah.
I'm like, man. But just her getting into the chamber, she could barely get in because her Achilles, it was not stable. So I looked at her, she looked at me. I'm like, okay, emergency, you can't even get into the chamber. Then yesterday she comes in and she's all, we were trying to figure out a schedule, and I'm like, well, and she looks at her husband and she's all, well, I have to wait. You have to drive me around. She's like telling him what to do. And I'm like, I said, really? I said, I thought you were fine. Cause I thought you were fine. She's all, well, I just don't think it's safe. I said, you don't think it's safe to drive? So how long is that going to happen if you don't do surgery? She's all, I know. So it was just hitting home.
You got her. She knows what she has to do, it sounds like.
Right. So, but anyway, but it was interesting that you had the same kind of conversations and the fears, which is totally normal, right? With anesthesia. I don't like it either. The last time I did it, I started having chest pains and like trouble breathing, and they had to figure out why. Like, I don't want to, what if they can't figure it out? Right. That was them putting me under. I was having a reaction to the anesthesia. So, so like, talk about panic mode, because you don't know, right? And then they're kind of rushing to trying to figure out, is it the dosage, is it the type of med, whatnot? And I'm like, man.
And were you aware of this while this was going on?
Because I couldn't breathe. Yeah. This was my last surgery. This was in high school. So it's been a while, so I don't know, but that's a memory that,
Let me tell you a funny story. It has nothing to do with, it's kind of sports medicine, but when I had my knee surgery, I went in, my right ACL, I blew it, MCL, ACL, fractured tibia, it was a whole
terrible triad.
Yeah. And so I go into surgery. To shorten the story, I come out, and before I go into surgery, they Sharpie your leg, right leg, left leg, they draw an arrow. This is the one. And I kind of thought that was funny a little bit. I'm like, man, you're sharp, like using a permanent marker on my knee. Like, okay, like I definitely don't want you to do the wrong one, So I come out of surgery and I'm knocked out. I guess I woke up for a second. I don't remember this, but I woke up for a second, and there's a nurse at the end of the table, at the end of the bed, I should say, as she's
Yeah.
wheeling me. So there's somebody pushing me from behind, presumably. But I wake up and I just see somebody at my feet, and she's looking at me, walking backwards, pulling the table. This is, she's explaining this to me afterwards. I don't remember any of this. Apparently, I wake up and she goes, "Hey, everything went okay." And I said, "Oh, good." And she said, "Your left knee is going to be good as new." And I said, "Oh, shit." And then I passed back out. And she realized, because she was looking at me at the head of the bed, she said left leg. She meant to say right. And she
Yeah.
goes, "I said left leg, and you said, oh, shit," and then fell back asleep. And she's like, "I meant right leg. I meant right." And she's like, "You were out. You were out." And so I wake up to her slapping my face, like coming out of anesthesia,
Yeah.
like, I don't
Yeah.
know, a while later. And she was sitting there, and the look on her face told me something was wrong. Like, that was the micro expressions. And I said, "Oh man, this probably didn't go good." I started to like trip out in my head the first second. She goes, "I just wanted to let you know I'm so sorry. I'm so sorry." Now
Like,
I'm like, "Oh my goodness, dude, I'm never running again. Like, what happened?" She goes, "You woke up for a second and I accidentally said it was your left leg. I didn't mean that. It's your right. We did the surgery on the right leg." And I said, "What are you talking about?" So then she tells me the story. I said, "Lady, I don't even remember that." She's like, "I've been sitting here feeling terrible for the last hour, thinking you fell asleep in a panic." And I said, "I don't even remember that."
That's
So,
great. What a story. Yeah.
man,
That's
I
funny.
just remember waking up being like, "Oh no, this is going to be terrible news." Like, just from the look on her
Yeah.
face.
That's funny. Not what you want to see. You want to
No.
see rainbows and sunshine and everybody
Yeah.
happy.
But I got to say, man, being basically naked on a table before surgery, talking to the nurses and talking to the surgeon, I wasn't comfortable,
No.
I was nervous, dude. I would have
Yeah.
rather jumped in the ocean, and I'm not a good swimmer,
Yeah.
It
Yeah.
was, yeah, it was concerning to me. I was concerned about the procedure. I was concerned about the outcome. I was concerned about waking up.
Yeah.
Um,
Yeah.
so when he said that, I said, "Hey, let's talk this out. This is something that happens every day." I told him I had some flying anxiety. I said, "I think of it like before I take a flight. Yesterday, there was thousands of flights and nothing happened. Like the surgeon has dozens of these surgeries, presumably a week, and everything goes according to plan. So let's just not, expect the worst, right?"
Right.
Um, but yeah, I don't want to minimize it. I think having any surgical procedure where you go under, I don't take that for granted.
No. No, that's why those anesthesiologists get paid the big bucks, right? Because they're
Yeah,
literally putting you to sleep and bringing you out. They're keeping you alive. Pretty
dude,
crazy, right? They have a
it is
lot of power. So you
really,
want that guy. So I'd rather that guy be as sharp as nails over the surgeon.
yeah,
I want
yeah.
that guy on point, right? But
Getting
yeah,
back
but
to the
yeah,
procedure where you're saying that patient of yours was saying that she wanted to have the surgery prone, right? Or
no,
supine, I guess.
yeah,
Yeah, versus prone. When I had my knee procedure, I was trying to get a patellar tendon replacement because a couple of the NFL guys that I work with had torn their knee right around the time I did, within the same week. I had my surgery 6 months later. I was trying to work through the football season. I didn't have health insurance at the time, so there's some mitigating factors. But both of the guys that I treated that tore their ACLs in that same week had surgery within days, and they both had a patellar tendon replacement. So when my surgeon said, "Hey, what kind of surgery do you want to have?" That's what I said. I said, "Hey, so and so and so and so had patellar tendon replacement. I want to have the same thing too." I'm not trying to shake off a defender or, run through the offensive line and score a touchdown like a running back, but I still want to be active. And he said to me, "That's fine. If you want to do that, that's okay. But I just want to let you know that when I do ACL surgeries, 95% of the time I do hamstring grafts." And that to me is like a slam dunk adjustment or slam
yeah,
dunk
yeah,
procedure. I do those all the time. I'm super comfortable with it, but it's your choice. If you want to do the patellar tendon, here's the downsides. It's more invasive, a longer healing time. It's a little, more painful perhaps. And he's like, I'll do that. I feel comfortable to do it, but I'm way more comfortable doing the hamstring tendon because that's what I do all day. That's my thing. So what am I going to say? I was
Right.
like, well, do what you're most comfortable with. You have a 99%, you tell me it's a slam dunk procedure, and the other one is like a free throw. Like, nah, bro, let's take the slam dunk procedure. Like, snip my hamstring. And so
Yeah.
that's what I did. I switched it up in that appointment just based on the surgeon's comfort level,
Yeah. Yep.
Have you heard of that in any other procedure, or, do you think that was foolish on my part?
To switch it up like that? No,
Yeah.
I would have done the same thing. Couldn't putting like let's put it in our shoes, right? Like if a patient comes in and says I want this type of adjustment right on my neck, and if I can do it, because we used to do technique and help, I help teach chiropractic technique, so I know a lot of different techniques. Can I move the bone? Yes, but if there's a technique that I'm bread and butter with and it goes smoothly, then I rather do that one, right? So I'll
Yeah.
I'll I'll explain that, and I've had that situation, and I've told the patient, I said, we'll move it any way you want, your
Yeah.
comfort level, but so yeah, so I'd rather go with the doc's opinion on that, and then and I'm sure you did it. Ask the well, why, and he
Yeah.
told you those 3 or 4 differences, which makes sense, which I've heard too, just because that's a big quad, little tendon attachment, right? And
Yeah.
so you're messing with that. So depending on, there's reasons why people will do that too. I think it's a little more of a secure and solid aftermath,
Hmm.
but by how much, right?
Yeah.
So like for these athletes, they want to make sure, especially, the big, powerful, type football players you're talking about, they need as much integrity of that tendon as possible. So that's probably why they made that decision. For
Sure.
us, that might be playing some pickup games and, weekend warrior stuff. Well, we're going to take our chances on maybe a smaller percentage that is not as stable or structurally sound, right? But
Yep. No, that makes sense. Yeah. Yeah, it just reminded me of that whole situation, whether it was the change up in procedure. I was like dead set. And then I came out of there and I was like, well, I audibled that one.
yeah, yep,
uh, um, Speaking of Achilles with your patient, Dre Greenlaw, the 49ers linebacker that we talked
yeah,
about a couple of weeks ago that tore his
mhm,
Achilles. I just read last week that his surgeon thinks that he could be ready to go for the beginning of football season. And his quote was something along the lines of, nowadays, 6 months is enough time to get somebody up and ready to go, even though it used to be a year thing. Now, he did say it wasn't a guaranteed situation.
right,
He just felt confident that there was a possibility that he could be ready to go. Obviously, month to month, they'll, track it, and there'll be a higher or lower probability as spring and as summer comes around. But I thought that was interesting that now that's two people that I'm aware of, Aaron Rodgers and Dre Greenlaw, who've had pretty significant, I mean, an Achilles tear is significant, so
yeah,
that
big
goes
time.
without saying. But the comeback from it and to have that possibility, that's really exciting, I think, and for an athlete, for someone to say, hey, you're out for a year, you're automatically like, well, I'll see you guys in November. I'll see you after the bye. I'll see you after Thanksgiving. And now, it kind of gives him a little bit of hope to grind a little bit harder, maybe. And I think that has to be encouraging for the team and the coaches too.
Yeah, for sure. Yeah, I mean that's a game changer for him, mentally.
Mhm.
So because he already told his teammates. We were talking about the quote, I think, or I read the quote,
Mhm.
but his teammates, when asked, how's he doing on that next day, they couldn't get to him because he was doing medical exams, MRIs, and stuff like
Mhm.
that. So the reporters were asking his teammates, and his spirits were high, and he was already telling them he's already ready to get back as fast as possible. So he already had that mindset, and then for the doc to be able to tell him, hey, I think we can do this within, that's going to just accelerate it that much more. So good
Yeah.
for him.
No, that's awesome, right?
He should be
Uh,
doing hyperbarics and LED, far infrared, all that kind of stuff that we know, right?
yeah.
PMF.
Yep.
So if any of his teams out there listening, let's go get them on those things.
All of it. It's
Yeah.
not just one thing. It's all of it. And I think somebody a couple of weeks ago was asking me which one of the you could take 3 or 4 different kind of post-surgery recovery type tools, whether it's hyperbaric or, like you said, LED, infrared, beamer mat, or PEMF, if you want to say it. And I said, hey, I don't think it's one thing. I think it's, a couple percent here, a couple percent here, a couple percent here. Now you have a 10% improvement, or greater, and it's noticeable, tangible. And, that's kind of how I look at it. I'm never like, hyperbaric is the solo key, or hey, I have this PEMF mat and that's going to really do it all. It's a combination. It's like it takes a team effort of a group of medical providers. It takes almost a team effort of modalities if you really want to do it all, in my opinion.
I agree. Yeah, no, it's because what works for one doesn't work for other, Yeah, let's talk about far infrared. I think we were talking last week, and then I think you even texted me that you had recently purchased something that
Yeah.
So let's go for that. Let's talk about
Yes.
it.
So yeah, I think it's interesting because I had someone say, well, is that just red light? Like the person that was speaking on it had a sauna, and their sauna changes lights inside. You can do, I think it's called chronotherapy,
Yeah.
red light, blue light.
Mm-hmm.
I was explaining that that's different. That's literally
Yeah.
just colored light. And so
Mm-hmm.
that can have an effect upon your mood, things of that sort. And I was saying, infrared light is different, that it has a healing aspect to it. And as I understand it, it increases circulation, increases, cell reproduction, and reduces pain. I bought this product called the Kinyon Move. Kinyon is, I think, how you pronounce it, Kineon.
Mm-hmm.
And it is 3 kind of LED laser red light nodules. I'll bring it the next time we do a podcast to show it.
Yeah.
But it comes with the strap. You put these 3 red light things on the strap, and then you can strap it on a shoulder. You can strap it on a knee, just like a wristband. It goes on, and you can strap it and turn it on. It stays on for a period of time for therapy. So I used it for my knee. I bought it for a client who has some stuff going on, and really all my client base. But look, I used it on my knee because it was hurting a little bit, like my patellar tendon was kind of achy. Sometimes it does that. And I didn't feel much heat from it. I didn't feel a ton of immediate relief from it. And so if I didn't know any better, I would say, oh, that's just a light on my knee. What is that even doing? It didn't do anything right away. Like if you put BioFreeze or something on, you feel that right away. And so there was no deep sensation. It reminded me a lot of using a PEMF mat where there isn't a lot of sensation, but that doesn't mean it's not effective, correct? So what is your experience with those products? And I also saw they now have light masks that people will wear for more cosmetic reasons, right? For wrinkles, acne, things like that. And so there's different types of light, red light, blue light, and those lights have different effectiveness for collagen reproduction or for acne reduction. So I feel like it's kind of having like a resurgence in a sense where there's a lot of companies that are making products that have this. So I guess my question to you is, what do you think of them? 1, and 2, are there any buyer bewares of look for this, don't look for that you're aware of?
Yeah, so I'm real familiar with it. I've been using low level laser since 2005.
Mm-hmm.
I'm real familiar with photomodulation and all its effects of that. So the biggest thing there, it's really the infrared that's kind of come to the forefront in the last probably 10 years, and it's even picking up more speed because it was the lasers and the lights for a little while, and now it's the infrareds. And I just think the education, that's kind of what I do with a lot of my patients because I get these questions, and I really want patients to understand the difference between everything. If is We're talking about wavelengths, right? And so we're talking about and how it affects the system. So basically, if it's a red color, it's the same spectrum of a wavelength. So regardless of what the device is, that's doing it, the end result's going to be stimulation of that mitochondria to release more ATP. We're talking about the red lights for right
Yep.
now. Okay. So anything that has a red color to it, that we can visibly see, that's under there's kind of different levels of wavelengths. And especially infrared, there's near infrared, mid infrared, and far infrared.
Yep.
And and kind of on the near side or lower is the visible light. The mid and far, you can't see it. So, and they will penetrate at different depths of the skin. So that's really what people need to know when they're purchasing something, or and then they want to know what to expect to feel. So anything in the mid or near, you will not feel anything in the mid or near range. It doesn't penetrate deep enough to produce any kind of thermal effect.
Any
The
heat, right?
the far infrared is where you start to feel heat. So far infrared is basically what sunlight is. We can't see it, but we feel it. Okay. So anything that says infrared, especially mid or far, you can't see, but you can feel. Okay.
Right.
So that's what people need to understand when they're seeing these different devices. So you should expect, and if you really can't feel it, then you're thinking it's a mid infrared. They can still advertise for infrared, but for like that device, it's probably at the mid infrared where it's a really, if anything, a very low feel or nothing. Where
Yeah.
the saunas, the infrared saunas, the whole point is to feel that deep heat.
Yep.
Okay. And what happens is the infrared will penetrate about, for the far infrared, penetrate up to 3 inches within the body and get those deep vessels. And they're really using far infrared to detox the system. So you're really getting,
Cardiovascular benefits as well, right?
well, that starts at mid. So
Yeah.
mid starts at mid is really for circulation and for ATP and cardiovascular. Far infrared does that as well. So far does almost everything, right?
Sure.
So, but at each level. So let's go back to what you were talking about with the skin. So mid or near infrared,
Near.
or the red lights, the green lights, the blue lights, those have been shown really to help with. It only goes to the epidermis level, so very shallow, just
Centimeter,
right.
maybe.
Yeah, right at the skin, or not even that, millimeters. It's at the skin level, so the epidermis. So that's been shown to help with collagen repair, tissue repair at the micro level there. So that's why you're seeing a lot of those the lights that you can visibly see for skin rejuvenation and tissue and collagen repair. So
Yep.
great for that. And then when you get into the mid range, that's the purpose of a mid infrared, is to actually help with at the circulatory system. It helps with the vasodilation, get more blood flow and oxygen to the tissues, ATP production a little more. So you're actually helping a little more with more tissue repair for more significant injuries. Then when you get to that far infrared level, you're going even deeper. The mid range is at the subcutaneous level. That's where the kind of the fat level is. Okay. So you're getting deeper. So you're pulling more things with the ATP, and that's where you see people when they talk about fat loss, they're at that mid range, because you start to increase the ATP and the metabolism at that point.
Gotcha.
You have to do it a lot to actually see fat loss gains, but
Yeah.
research shows it does. And then at that far infrared, you're actually going really deep, increasing that heat really deep. That's why you get the heat from within. So it's a different type of sweat, because you're actually heating inside out. And so you're going to pull any of the metabolic waste and detox out with you. So from a tissue injury standpoint and from a cellular detox standpoint, the far infrared, those saunas are really pulling that out. And at the same time, you're getting a lot of good tissue repair. You're getting a lot of hormone release. You're getting a lot of those good benefits for tissue repair. But that's why you would do at different levels, and why different companies would say. So this device that you're talking about, I've seen those, and I've had people ask me, should they get them or whatever. It's a pricey, a price point. But what's nice about it is it's the vehicle, the delivery system
Right.
that's what's unique about it. Because you can buy a $50, as long as it has that red color, you could
Yeah.
buy a 50, you could buy, a $200, $300 infrared and hold it, and it would take longer, right? These more expensive units, you're paying for the way it's delivered, the accessibility of just clipping it on or strapping it on. You don't have to hold anything. You can move around, do things
Yep.
with it. That's super nice. So you're paying for that. That's a huge bonus. And it's also, so you have intensities, wavelengths, frequencies, and then you have intensities. So the more expensive devices, you're getting at different intensities to accelerate the treatment time.
Right.
So that's another thing people have to look for. Well, why is the difference? Well, I have like those little laser pointers. They can get the job done that you got from Office Depot, but it
Yeah.
would take 10 minutes what I can do in 120 seconds with my high powered 635 nanometer wavelength, right? It's
Sure.
the same wavelength spectrum, but the intensities or the treatment times are going to be different based on the mechanism. So that's where you're spending the difference in price. So.
Yeah, and time is money, right? And so
Right.
it's also what is most effective. If I gave you something that is cumbersome or tedious to use or takes a long amount of time,
Yeah.
now, if a treatment takes 30 minutes, 45 minutes, what is the compliance there versus something that takes 2 minutes? Or with this Kinyon, you can strap it on and kind of put it around your knee, put it around the affected body part, and continue to move,
Yep. Yeah, I like it. I had a real quick, sorry to interrupt,
Yeah,
but
yeah, no
I had
problem.
a patient, remember we were talking about my decurve veins patient last time?
Yeah, yeah.
So she's been using red light. I didn't realize, she said she's been at home. That's what she purchased. She
Oh, I
purchased
see.
that so she could put it on her wrist. She's one that doesn't want to stop and, do anything. So she's been wearing that last visit. So if you remember that episode, I was telling you how I kind of laid it up to where, it's going to take a lot of treatments. We were talking about treatment
Yeah, you
time
said
and
like 30
12 to
treatments
30.
maybe, and she was tripping.
Yeah. And then because she wanted to hear a few and she had already started a few. Well, since then, and then she said she wanted to schedule with me knowing that I already said that. Well, our second follow-up, she was all upset, like bummed,
Oh,
like
no way.
she was sat in the treatment room. I
Yeah,
walk in the treatment room, I'm like, what's going on? And she's all, it still hurts. I'm
yeah.
like,
Ah,
what did we talk about? I said,
yeah,
how many treatments have you had? Well, I haven't had any with you. And this
yeah,
is my fourth with the ART guy. I
yeah,
said, I understand. Remember our conversation? So even though she agreed and signed up to be a patient, it was just funny because I was listening to our episode over since that had happened. I'm like, oh my gosh, like we try our best, but patients, they'll hear you,
yeah.
but they won't listen, right? There's a difference
Sure.
between hearing and listening, right?
Well, you're
So I had to,
optimist,
yeah.
You're like,
So
hopefully
I,
that pertains to everyone
yeah,
else and I'm
yeah,
the
not
exception.
me. So
Yeah,
to that point, she wanted to return her what is it called, Kinyon, or
Pinyon, yeah,
yeah, she wanted to return it because she's all, it didn't work. She only used it for a little bit, and I'm
yeah,
like, I said, okay, here's the thing. I said, she's all, should I get rid of it? I said, you can, because it's a hefty price, and you can get
yeah.
your money back, especially because she's not an athlete type,
Hmm.
she's a weekend warrior. I said, you can get rid of it. I said, but I just want you to be educated more than your neighbor. I said, it is 100% working and doing what it's meant to do, just so
Yeah,
you know. Whether you feel it or not, that's a different story. But is it doing all those physiological benefits that you purchased and signed up for? No, I wanted something that got rid of my pain. I said, I
yeah,
understand that, because that's what they advertise too, right? Pain relief. But I
yeah.
wish the advertisements would be a little different, right? So
Well, I said to this particular patient, he's trying to make a change in his health. And I said, did you go to the gym this weekend? He said, yeah. And I said, are you yoked? Are you done? Like, is that it? You went one time. Now
yeah,
you got it and that's it.
yeah,
He's like, nah, it's going to take a while. I said, yeah, it's really no different. You're trying to work out to build muscle. And in this instance, you're trying to heal to repair tissue. And that takes time, man. It's not just a one and done, and
mm,
I almost find those conversations comical sometimes, but also equally like it's something that I enjoy in my practice is to just provide a little more clarity when people have some confusion, or there's your expectations are off, so just to kind of reset you and be like, hey, you're on the right track, you're doing the right things, this just takes time. I guess reassurance is the word,
Mm-hmm.
that's something that I do every day, is reassuring somebody, hey, we're on the right treatment plan, or hey, this is going to be okay, if they just came in with something that's concerning to them. So that's something I enjoy just as much as a really good adjustment that I know is going to reduce pain or increase range of motion, is to kind of give somebody a little bit of a perspective, and that's necessary,
Yeah, no, that's part of our job, right? Being a doctor, an educator, right?
Yeah. Yeah. I mean,
Yeah.
we're all human. And so I think you can catch somebody on a good day or a bad day. And, life's, here's the theme that I'm finding in my practice. And I don't know if you are as well, if you can speak candidly, is I feel like a great majority of people coming in are, well, I'll just be honest, like extra stressed and also a little bit a little discouraged, a little
Mm-hmm.
like, I'm tired, I'm burnt out, I'm fatigued, like just like a grind down is a common thing. Not everybody. I have,
No.
people who come
Yeah.
in who I had a great day, things are good, but
Yeah.
the overarching theme, if I said, what is the vibe for the week? The vibe is, I'm tired of work. I need a vacation. Things are stressful. Everything's expensive. I don't have enough time for myself. Like, is that what you're finding? Or is it just, I don't know, some wintertime blues that I'm experiencing over here?
Yeah. No, I agree with you, and it's unfortunate, that that's kind of what's going on in the world. Everybody's taking that on. I think, especially here in California, we're just being hit by tons of, politics. Take the politics out of it. It is what it is. We live here for a reason, and we get all the benefits of that, but we also get the benefits of the higher taxes and especially business owners like us, we're getting hit on all kinds of sides, so I think it's a trickle down effect. So everybody's feeling the effects of the higher, price of living out here, right?
Yeah.
So I think, and it's wearing people down. They're trying to keep their head just above the water, and get their nose right there, and then a wave
Yeah.
comes, right? And
Yeah.
it's like just when they feel like they're getting there, something else happens, and it's just like, damn, can't catch a break. I keep hearing that, like, I
Yeah.
can't catch a break right now. I can't get, and so I've had a lot more people like crying in the office. It's unfortunate, but we're there to give them a moment of, like what we talked about before. You got the physical part, the mental part, and the chemical part, right?
Yeah.
So we can help with the physical and the mental and educate them on eating the diet right? So at least we're that one moment of time where we can give them some kind of clarity and lift that fog a little. I feel like we're doing our job, and then hopefully it's enough to carry them on to the next day.
Yeah.
You
And,
know.
not to be a psychiatrist or psychologist or anything, but I do believe when you're in pain, your mood is off.
Mm-hmm.
If you're injured, your mood is off. If you're rehabbing and you're making progress, but it's been a long road, your mood is off, And for some people, that's frustration. For some people, it's depression. For some people, it's anger. It affects you, is I guess what I'm saying. And so your health, I mean, it's not some profound statement, but your health matters, right? And it affects your mood. And I was saying to somebody a few weeks ago, like, what are you doing to change that? Like, there's all these external factors that you can't control, layoffs at work, increasing cost of some stuff that was going on with his kids, where he's like, I don't want to pull them out of this, but, how do I make ends meet? And the conversation was, what do you do? What can you control and what are you doing? So is the alcohol every evening, is that helping the situation? It might, take a little edge of the stress off. Look, I'm human too, like I get that. Or is not going to the gym when you used to go work out all the time and used to swim at the Y 3 times a week and you haven't done that in 3 months, you think that could be affecting you and making you feel a smidge worse, And so
Mm-hmm.
that was our discussion, is, well, maybe if you can get into the activity level again, maybe that'll increase maybe that'll create a chemical change that'll increase your mood somehow, or yeah, we were kind of reflecting on those things, like what can you control that could increase it. And so the conversation was, let's be mindful of evening intoxication every day. And if that is a habit, or that's, something that he enjoys, then moderation's better than excess. And also the exercise thing, is like, you're going to feel better if you feel stronger. You're going to feel better even just going and doing the reps. You're not trying to get yoked. I mean, look, I've never left the gym and said, hey, that was a waste of time. Even if I go for 10 minutes, it feels good. And it has a chemical reaction in your body that releases endorphins, and I think has a positive effect on your overall mood. So I don't know. I don't know if that was too hokey, or if it was, just like a thing that's going to make a micro difference and not a major difference. But it was a discussion point we had,
Yeah, I think you're right on. Little touches, right? It might not be cosmic, like he saw the light, but
Yeah.
he might be hearing but not listening yet, but it's somewhere in there, right? And so the next time he might sit down for that cocktail at night, he might hear your voice a little and be like, okay, I'll have half of it tonight, and put it off to the side.
Well,
And
it's the
so,
reasoning too, in my
yeah,
opinion. It's like, if you and I are having a cocktail, we're having an old fashioned, I haven't seen you, we're having dinner, we're telling jokes, cheers. That's different than, man, today was aggressive. Let me just put
yeah,
2 back. Let me put 3 back so I can sleep, because I can't sleep because of stress. Now that to me becomes not healthy, and can become a problem. And so that was it. I wasn't saying, he has a big issue with it. It was just like, what can you control? And at least I feel like when I'm in control of even something a little bit, it makes me feel like I'm being proactive.
yeah, 100%.
Yeah.
Yep.
A lot of my athletes will say the same thing, where they'll say, like, well, what is it that I can do? And that to me says, well, what can I control?
Yeah.
And it's like taking back some responsibility, some ownership. So
Mhm.
yeah, I hope the vibes change. The time changes March 10th. We have a little, what do they call it? Spring forward, so it'll
Yeah.
be, hour later in a couple weeks, and the sun will set a little bit later. And at least here in San Diego, I do notice a shift in mood in people when it's dark at 6 p.m. versus dark at 7:30. The
Yeah.
vibes are just different. You get out of work and it's not pitch dark. I think it feels different.
Yeah, for sure. Yeah.
Yeah. So hopefully we'll be out of these winter gloomy months soon. And also, I recognize there's people that listen all around the country, and it's still 60 degrees in San Diego and Southern California. So I say that
Yeah.
without, I don't want to get yelled at by people in Boston and New York and,
Yeah.
on the East Coast. I recognize you guys are savages out there.
Right.
Yes. Well, what else is on your mind, Dustin? What else is going on? I had a couple patient cases I wanted to talk about, but tell me about your
Yeah.
week and anything exciting.
Man, I was trying to think. I had some stuff yesterday, and I was like fired up to bring to the table. And we sit down here first thing in the morning. I'm a blank slate. Like, I can't think of
Yeah.
anything. So I got, like we always say, I got to write it down. But it always happens when I'm driving, or
Yeah.
or spur of the moment, like with a patient. I'm like, this would be a good one to talk about, and then life goes on, and I forget. So I'll bring something to the table next week.
No worries. No worries. What I started doing? I have 2 things. I have a little notebook, I guess you
Hmm.
can call it. Has a little elastic strap on it, and I keep that in my car just so I can write stuff down, because same thing, I'm in my car a lot. And I don't know, man, I purge a lot of information out of my mind. Sometimes I feel like I have a list of 3, a max of 5 that I can, like, grocery list or things to do. Anything over 3, maybe a max of 5, then I'm writing it down. I'm
Yeah.
like, let me get this off my, the front of my mind. I want to purge this and not have to worry about forgetting it. And the other thing I do is grab my phone and I'll just tell Siri to leave a note in my notes app. So if I
Yeah.
don't have a pen handy, it's like, make a note in the notes app, and then somewhere in my notes, it's there for reference later. That's what I've been doing, but there's a lot, when you think
Yeah.
about patient cases and you're thinking about what to do as far as treatment. And yeah, there's a lot of things to keep track of on the day to day, so that's how I do it.
Well, I hate to, I hate to bring this up for you, but you're
Uh-oh.
below average.
Yes.
Just so you know, because yes, you agree. You don't even know
Yes.
what I'm going to say. So you said 3 to 5. So the average, what research shows, is that the average person could remember 7.
7.
So
Okay.
yeah, so I want you to work on that. Okay, so
Yeah.
up your game. That's why phone numbers are 7 digits.
No, that
So
makes sense. I
so
could probably do that. It makes me feel uncomfortable. Then I'm constantly like
yeah,
milk, bread, eggs, and
yeah,
I'm like, oh, what was that last thing? Ah,
yeah,
waters. I forget.
yeah, yep.
So
So
it just
stretch
makes
it.
me feel better to purge it. Like,
There you go. I hear
yeah,
you.
I must be getting rusty. I need to hit. What are some mental supplements I can hit that'll help me sharpen up, Dustin?
Ginkgo biloba. Let's go. Some,
Right.
yeah, let's get that one.
That's funny. uh, Let me ask you this, and then I want to get to the reason I'm asking you the question.
Yep.
How often during the week do you have a patient come in who you're going to adjust or treat in the manner that you normally would, and then for whatever reason your instinct says, not today, like I need to do a little more research on this, or something doesn't feel right in the joint, and so I'm going to pause and wait and revisit it. I feel the reason I ask that is because I think at least once a week I seemingly feel like I get lucky in making a choice that is a correct choice. And then in retrospect, I'm like, man, was that instinct, or was that like an accumulation of knowledge that I paused there? What was that? Because I look at those instances as like, good thing I made that decision, because if I didn't, it could have been a shitty outcome.
Right.
And I'm comfortable in following my instinct, but it does stress me out a little bit to know that sometimes once or twice a week we have those situations arise. So how often do you feel that way? And then I'll explain why.
Yeah. So I think, and me and you practice very similar. Our treatment plans and our sessions aren't cookie cutter. It's when they come in, we'll kind of figure out what we're doing, right? Whereas a lot
Mhm.
of, and I say that for the listeners because a lot of practices, it'll be pretty much scripted out. A treatment plan will be scripted out. So the doctor will make a plan, and then every time you come in, it's pretty much the same segments you're adjusting. It's the same thing. And then they'll revisit in 6 visits, see if there needs to be any other change or something like that. That's an example. For us, I think we do things where when they come in, I have a general idea what I want to do and work with because we have a goal in mind. But as far as depends on how they're moving that day, and so I'll change things up. But to your point, I don't know if it happens weekly, but when it does happen, it's a huge, like you're saying, like aha moment, or not an aha moment, but I do take note of it because
Right.
it's a different feeling. It's weird. Like you said, is it intuition? Is it something in your gut, And so I think we've been doing this so long that I think it is a combination of all our education and all our, experience. But I also think we're really in tune with listening to our gut and going with our just an innate,
Think.
what we, yeah. So, but when it happens, it is something that I do take note of. And it's kind of interesting you brought that up.
Yeah. I had a home visit this weekend for a patient who um, I've been seeing for a while. And she said, hey, can you see my husband by chance? He'd be really interested. He's a little apprehensive about seeing a chiropractor. He has before. He had some reasons that he wanted care. He's been following you and sees the athletes you treat, and he's super active. He's always been active, and he wants a little different care. He's been to PT. So I went and did a home visit. And on my way to the home visit, he texts me and says, do you have time to see a friend who's with me? And I said, sure, I'll make a little bit of extra time. It was Friday afternoon. And so I decided to do that. So I treated the main guy, and standard issues, young, athletic, and, nothing worth pausing to discuss. It was regular kind of 1 hour treatment is normally what I do during home visits. And so that's what the time took. And then his friend was there, coworker friend, and I'm seeing him, and he's like a fighter, MMA, jujitsu type of guy. So he had some neck issues, had some stuff. We had a discussion, some education talk, and I'm wrapping up and I'm ready to go. And he had his girlfriend there who was also there. And she goes, "Hey, do you mind if I jump in on the table too?" You know, that happens sometimes, right? And you're like, I was really like, I'm trying to hit,
Mentally,
I'm trying to
yeah.
hit the road before
Yeah.
traffic hits. It's Friday. I'm going to get caught in like an hour and a half of, but I was like, yeah, of course. You know, I can't remember the last time I said no to somebody. So I
Right.
said, lay down.
So
So
tough.
she sits down and, you know, I check her shoulders out. I'm doing range of motion. I'm just kind of going through our normal not report of findings, but normal exam. And she's like hypermobile, you know? I'm like palpating her back. She has some things on her ribs, which I've seen sometimes in females, like the lower ribs will be a little bit off, or maybe one side is a little more anterior. And I say I've seen that in females more than males, sometimes after like breast augmentation, or if you have scoliosis or something like that. That's been my experience where I've seen that before. She didn't have any of those issues, but, you know, I go from her being prone to supine, and now I'm just checking some things. She has some like hip issues. And this is what got me is I was checking out her hip, and I flexed her hip and was kind of checking her hip flexor and just doing some like hip abduction. And I laid her leg down and just kind of tractioned her leg a little bit. And in her hip joint, like I can gap this finger and you can probably see that gap a
Yeah.
little bit. It was like that in her hip. But when I say, Dustin, her hip moved inches, like
Oh man.
inches.
Yeah.
And I wasn't tugging that hard. You know, I was just
Yeah.
like distracting. And I was like, whoa. And her whole pelvis, left pelvis, all pulled. And I was like, right pelvis. I'm like, wow, that is wild, you know? And
You don't want to
she's
say
having
weird.
like, yeah, she's
I
having
put
like
that in
hip
our
movement.
head like that was weird. Like, yeah.
Right. I'm like, that is a lot of gapping. That's a lot of motion there. So, you know, put her back prone. I'm checking different things out, checking her cervical range of motion, checking her shoulders. And at the end of it, just to shorten the story, I said, you know, I'm not going to adjust you today. Um, let's focus on the trap shoulder tightness. I can do some soft tissue, some ART with that gently. And let's focus on some mobility work. So I had a band with me and I had her do some kind of resisted hip flexion band stuff and some, I call it open the gate, shut the gate, like some
Yeah.
just hip movement, just to kind of get an idea of range of motion. I said, you know what, I'm going to marinate on this. And when I see you in a couple of weeks, we can revisit it. I'll reach out to you tomorrow. Let me know how you feel, et cetera, et cetera. And so then I'm driving home and I'm thinking about this. I'm like, man, maybe I should have just adjusted her. I kind of feel like she wanted to get adjusted. I did all sorts of other things and I just didn't give her what she wanted, which was an adjustment. And so I was thinking it out. So I sent her some follow-up questions, asked her if she had any labs, had any this and that. And then she responds to me saying, "Oh, by the way, I might have Ehlers-Danlos syndrome, perhaps. At least that's what somebody told me. I don't really know what that is, but like, have you, I don't know, maybe you should know that. Like, I'm not 100% sure if I do or don't, but somebody told me I might need to go get some lab tests done or see something. I might have some like genetic predisposition, and there's some like heart things that made my last doctor think that it might be, you know, testing. I did a full history, you
Yeah.
know, as much as you can when you're like doing an
Yeah.
add-on, I'll call it, right?
Right.
So I didn't
Right.
have like, and I just thought to myself as I was driving home, like, God dang it. What if I was just tired on a Friday afternoon or just was like, yeah, hurry up. Let me just knock you out. Let me just, you
Yep.
know? So knock on wood, I was like, man, thank goodness that that little voice was like, maybe today you pause. And I don't typically do that. You know, I'm
Right.
like, hey, it's pretty safe to adjust almost always. And
Yeah.
so that explained the super hypermobility. And there was a second where she's like, my hip just hurts. I just want it to pop. You know, I just wanted, if I could just get it to go. And there was a split second where I was distracting and I was like, well, let me just get a quick little, like, you know,
Man, yeah. You dodged a
and,
bullet there, man.
and that would have been terrible. Right.
Yeah.
So,
Potentially.
um,
Yeah.
so I don't really encounter that syndrome often. Have you in the past? I don't even know if I'm pronouncing it right. Ehlers-Danlos, is that how you say it?
I always butcher it Ehlers-Danlos, yeah.
Ehlers-Danlos
But
syndrome.
that's how I've always said it, but
I don't know
Ehlers,
how to say it, but I know what it is and what not to
yeah,
do with it.
you're right, exactly. So yeah, so it's a genetic disorder. Yeah, so it's a genetic disorder that affects all demographics and walks of life, men, female, equally, and all races equally. It's a genetic thing that can come from one or both of the parents, but it's one of those things where it so for people that listen, like you said, hypermobility is the biggest thing, and tissue laxity. So these people that, as kids, like their little party tricks would peel their skin from their neck, and everybody'd go crazy, or from their elbow they can pull it really far, or even from their forearm, or
Hmm.
anywhere on their body their skin was really lax. Or even growing up, for teenagers or in their 20s to bruise really easy. That's one of the signs where, when we're younger, we shouldn't bruise very easily. So if these
Sure.
kids coming through bruise pretty easy, that's something that we have to, look into. Like you asked about labs and stuff. That's the, right questions to ask, is, we need to figure out why you shouldn't be bruising easy, right? Heart condition. So to answer your question, I've seen quite a bit of it, because I treat a lot of dancers, a lot of ballet, a lot of
Mm,
dancers. So it's typically that tall, lanky build, right? Typically,
yeah.
that's the typical stereotypical look, is the taller, lanky, very slender, thin, almost sometimes concave look, of their chest, and you can see the ribs and stuff. So it's kind of the look, where they don't really have a lot of meat on their bones.
Hmm.
That's the typical thought process, but it doesn't have to be like that. But so I see a lot of those, because that's the same kind of look in ballet, right?
I see.
A lot of them, not all of them, but
Yeah, yeah.
so I do see it from time to time, especially because in our profession, when these kids are younger, they're coming through and they keep spraining their ankles. They keep, having hip issues, things that are not resolving. And it's just one after another, and they barely did anything. Routine things causing. Well, that's because their joints are hypermobile, like that hip. And it's
Hmm.
just so much easier when you're putting yourself in those positions. Now, if you're just a student sitting at a desk and doing your homework, coming home, doing more homework, you're not going to really experience those extreme ranges. So you're not going to notice it happening. You're going to notice more like the hard stuff, the bruising stuff. You're not going to get the sprained strains like the athlete will, right? But yeah, unfortunately, there's not really much treatment to do for it. It's really more prehab and strength and conditioning to
Yeah.
strengthen as much of the muscle tissue around it, because it's basically, like I said, a connective tissue disorder where you're not producing the right proteins and genetic makeup to have stable tissue.
Yeah.
So it's a tough one.
Yeah. With her, she had asymmetrical pattern, I'll say, in her lower spine. So she had this kind of displacement of her rib, where one side of her rib cage was a little more anterior, her left side, and therefore she felt like her left hip was also anterior. The bottom of her ribs were kind of poking out. And so she had this kind of rotational imbalance that was going on. And that's why she was like, man, I just want to get my back. I just want you to adjust it to take that rotation out. And, the next time I see her, the conversation is going to be, like you said, about corrective rehabilitative exercises and how to, I guess, strengthen what's weak and maybe stretch or lengthen what is a little tight. Although with her, there's a lot of hypermobility. And so she's out of balance, basically, and
Yeah.
so I got to try to help her navigate how to try to correct that,
Yeah.
in a conservative, I don't want to say passive way, but, in a manner that doesn't involve aggressive adjusting, like I
Yeah.
think that's more stretching and working out and things like that. So,
Yeah, it
um,
definitely doesn't have to be a death sentence for a lot of people. I mean, depending on your sport and your activity, but there's definitely, I mean, there's tons of people out there in the world that have succeeded very well in life with the condition. So it's just learning how to manage it.
mhm.
I found where certain area, like with adjusting, right? You got to be really careful with the neck, right? Because that's one we want to, with the the hypermobility up the upper cervicals. But there's other ways we can move bones, right? We can use drop tables. We can use instruments like activator or stuff to still help people. I found like real low force thoracic adjustments, just enough to get to decompress the joint to get the pressure off of it. We don't have to do a full, what patients perceive as a body slam type adjustment. You can rock it back and forth and get it to cavitate and move in a stuck spot without overstretching those ligaments. You can still adjust manually without taking it past its physiological end range, is the speak that we talk in chiropractic college, right? So, you can still get the movement even in the SI joint, the sacrum. The drop table works great, but I can put somebody in side posture and do a really nice little joint mob and get it to adjust, right? So can you. So for students out there and other docs listening, don't necessarily be afraid to, help and be a chiropractor. Just learn what you have to do not to, put it at risk. Above all else, do no harm, right? So
that's it. And I think that's very succinct and well put, because if you're thinking of an adjustment, you can go with a quick, deep thrust, which cavitates the joint and creates, some audible and you got movement. However, for people who are in a lot of pain, or people who've never been adjusted before and are apprehensive, or somebody like the patient that I just spoke of, you can make improvement without adjusting the joint, like you said, by just mobilizing the joint. Let's move that joint up and down. Let's see if it has some rotation. Let's see if we can just get it loose a little bit, and then move to the next joint and see if we can mobilize that and get that loose. And then you do that all up and down the spine. That makes a difference. I mean, if you told me to mobilize my T9, what am I doing? Rotating, flexing. But if I lay down and you did it, 20 times more effective. Like, I know you can get to that joint, and I call it knocking the rust off sometimes, where it's like, it's stiff. So, we're not trying to hit it with the hammer. We're just trying to knock a little rust off and make some improvements,
Yeah.
So that's a good reminder for me as well.
Yeah. I just remember, I liked your story about this patient and how it wasn't until the next day she told you or whatever.
Right.
So I just remembered I had a new patient 2 weeks ago, did not fit the demographic of what we're talking about. She was in her 50s, overweight. She had gained 20 pounds in the last 4 years since COVID. She was starting to work out again. She was having joint pains all over, really having a hard time. Her trainer referred her, but we get through this whole long history, and I took about 30, 40 minutes because she had a lot of background history, and she was actually a healthcare provider, doctor as well. And, but anyways, it wasn't until like the last sentence she told me, "Oh yeah, and I have Ehlers-Danlos," and I'm like,
"Oh wow,
what the hell?" Like, how about let's lead with some of that?
Lead with that,
like,
right.
Yeah, like when we're talking about all this joint stuff, you would think, But to your point with this other one, like this doc, she's like, yeah, I've gone through things and I've been told that this is what's happened. She never really dove into it because it wasn't really affecting her life. It wasn't a major issue for her. She's just been told with all her symptoms, because it's more of a symptom-based diagnosis, or, a history type diagnosis. So she really didn't do anything with it. So for her, she's not thinking anything of it. And so to your patient's point too, to her, it doesn't mean anything. It's just, I have loose joints, right? So, but to us, it's important. But just for our students and our docs out there, just to remember, like, that's pretty common. I rarely have a patient come in leading with that when they talk about it, because they're coming in talking about their issues, not what somebody's told them they've had. They don't even think it's an issue.
Yeah. I mean, it's almost a good practice at the end of your history taking, just to say, hey, is there anything else that I didn't ask? Anything that I left out? Anything that you think may or may not be important? Just something that you might think is innocuous. Like, let's mention it, and they might be like, actually, it's something very important,
Yeah. How many times have you had this? Well, it probably doesn't happen many times, but I'll be adjusted. We get done with our intro and everything, not with a new patient, but with an established patient usually, and get done with the adjustments. And I even ask anything new. No, 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 no. And I get just, oh, I forgot. I got in a car accident over the weekend.
Right.
And I had a headache over the weekend, but it's better now. So I didn't think anything of it. I'm like,
Yeah.
or I fell off my horse. I'm like when I ask you, is
That's
there anything
significant.
new? I literally lead with anything new since I last saw you.
Yeah.
But they don't think about it, because they're
Yeah.
fine now, right?
Sure.
So it's just funny.
That's hilarious.
Human nature.
And they're like, you'll figure it out.
Yeah,
Figure it out, Dr.
Yep,
D.
we
You
hear
got
that
this.
all the time. Yeah.
I don't need to tell you. You'll figure it
Yep.
out. One last thing before we get off, I wanted to bring up something from last week that you mentioned. And I've thought about it a couple times since then, which is kind of funny. The difference between patient and client, because I use those two things interchangeably. And last week you said, somebody called us out about saying patient or client. And
yeah,
I gave
their
some
quote
thought
was,
over
I've never heard a doctors call their patients a client. That was what, and then they
that
did
was a
the
comment.
laughy emoji. They
I
thought it was
see.
funny.
I might have been guilty of that. That probably was me. Yeah, I don't have any explanation for it. I think of patients as clients and clients as patients. I guess there's a distinction between, if I parse it out, that a patient is more medically based and a client might be, like you come to the car wash and that's your car wash client, So I guess there's a little less formality there. But what is educate a farm boy here on the best way to speak about these terms?
So I think it was Dr. Henninger or somebody. It was one of those off topic, not part of one of our classes, but somebody brought it up at one point, and it always stuck with me because I come from a world. Prior to chiropractic, I was a personal trainer and strength and conditioning. So we had clients, right? So
Sure.
So when they had this conversation, I was able to resonate with it because I could understand it. So the biggest difference that I was taught was that a patient requires a treatment plan. So there's a treatment plan and diagnosis associated with the patient. A client does not necessarily have to have a treatment plan and diagnosis. So you can come in for soft tissue just to get some mobility work and to tune me up, right? I have no issues. So they would be a client, right? You go, massage therapists work on clients.
I see.
Healthcare providers work on patients. So you're
I'm
kind
not
of a tweener
entirely wrong.
because you were a massage therapist in the past. So that's why I never gave you crap about, because you're in that world. You could have clients, but to my doctor friends, I always correct them. So
No, that makes sense.
That don't have a massage background, right? But you do.
That makes sense.
So you're allowed to interchange them because you do. You have some pure just soft tissue people, and you have
Yeah, I'd say, everyone that comes into the office is a patient if I'm being specific about it. But I do have some athletes that I would say are more clients than patients. Yeah. Sometimes the clients become patients because of something that happens in season or off season, and we treat them as such. But to be honest, the NFL guys specifically that have had long careers, like the average NFL career is 3-point-something years. So these guys, I've had 6 or 7 guys that have played in the league for 10 plus years, and that's unusual. And the thing that I found in common about them is that they got work before they needed it. Mm-hmm. So they were getting work when they were rookies versus getting work once they got injured. And so they came on without any issue. I guess technically they were clients then, and they hopefully stayed clients if nothing popped up as far as an injury went. But frequently, it's the NFL, so a client becomes a patient, and then hopefully they're back to being a client again, I guess. If you're, splitting, what do you call it? Splitting hairs?
Splitting hairs, yeah. Well, we'll talk offline about some more legalities about that with the teams that I've learned over the years. So just some cover our ass type stuff.
Yeah.
Yeah.
No, that's good. Well, I'm always interested. It sounds like a conversation while you're on the 405 and I'm on the 5. We can hit each other up during a commute and break that down.
Sounds good. Yeah. More of a boring conversation.
Yeah.
But a good one to have for both of us. as a reminder.
Oh man. Well, let's get on with our week, man. What are you looking forward to this week? Any highlights before I let you go today?
Mm, no, just yeah, I got a lot of hyperbaric going on, so it's been
Yeah,
good. That's been fun because I just like educating about hyperbarics because it's not something that a lot of people. I know I keep talking about it, but it's just something that's not very accessible. And right now, there's a good momentum going with it
good.
with my business, and I'm getting a lot of referrals, um, and it's just changing people's perspective on things and giving them some hope on some things. So this week it's pretty full with hyperbarics. So
That's
I'm
good.
pretty excited about that. Yeah. What about you?
Just it's the end of February this week, right? So March 1st on Friday, I believe it is. And yeah, I just make a list every month of things I want to do that month. And so as we come to the end of the month, I'm going to revisit that list from the weekend or from the beginning of the month, but revisit it from the last time I looked at it. And there's one or two things that I have left on that list of February. So I want to knock that out. And then sometime this week, Wednesday or Thursday, I'll make a list for March of goals and things that are must do's. So really, that's it. Just trying to have a productive week in the office with patients, and yeah, trying to knock out this to-do list. And then next week, my parents had their 50th wedding anniversary a couple months ago, and one of their gifts was um, a trip for a few days out of state. And so I'm going to go meet my parents early next week for a day or two. And Kelsey and I are going to go up and meet them for at least a dinner, surprise them and hang out with them for a day. So that'll be nice after the week's work, but just a regular week, really. It's football season's over. There's no baseball yet. Basketball is kind of swinging into March Madness. So I'm going to be excited about college hoops soon. The NBA's just finished their All-Star break. And so we're kind of in a little bit of a transitionary time sports-wise. But yeah, work-wise, man, the time changes. And I'm looking forward to the next couple of weeks.
Sounds good. Well, let's make it happen.
Yeah. Well, you have a good rest of the week, Dustin. I hope it gets started off right. And I'll touch base with you probably midweek, and we can pick up that conversation about patients and clients and touch base on a couple other things as well.
Sounds good, brother.
Hey, well, to everybody listening, we appreciate you. Tell a friend if you enjoyed us and enjoyed this podcast. We do read your questions and your comments, so keep those coming. We did have a couple people that asked if we could discuss a particular topic, so I'll bring that up to you during the week, Dustin, and we can do a little research and maybe answer those questions that some listeners had next week.
Sounds good.
All right, gang. Well, this is The Second Opinion. We're a sports medicine podcast. Again, we appreciate you. You guys have a great rest of the week. Everybody be safe, stay healthy, and we'll be back with you in a few days. Dustin, thank you for the time. We'll talk soon.
Thank you, buddy. Talk to you later.
All right, guys.